You're hot until you're not. Sleep has become elusive, and when you do fall asleep, you're likely to wake up drenched. You can't remember where you put your keys or what you had for breakfast this morning. And your periods, which used to come like clockwork, now they have a mind of their own. Welcome to perimenopause. This is the time before you hit menopause, usually in your mid-40s. But for some women, it can be even earlier. It's a sign of fluctuating hormones, with changes in your periods one of the first clues that things are shifting. By definition, menopause itself is just one day, the day you've gone 12 months without a period. It usually occurs between the ages of 45 and 55, although some women experience it earlier. Even after you pass menopause and are postmenopausal, your symptoms will likely linger, for some women as long as a decade or more. Every woman experiences this transition differently. Many are glad to see the end of menstruation and the risk of pregnancy. Others, however, may view menopause negatively. Many experience both sets of feelings. Remember that menopause is not an illness, it's a transition, and it's normal. Whether you're perimenopausal or postmenopausal, more than likely you're dealing with symptoms ranging from hot flashes, night sweats, and vaginal dryness, to mood changes, sleep problems, forgetfulness, headaches, and irritability. Menopausal symptoms, both before and after the transition, vary widely depending on the woman. By far the most common and debilitating symptoms are hot flashes and night sweats, also called vasomotor symptoms. Tied to hormonal changes in the central nervous system that help regulate your body temperature, they can strike at any time, anywhere. About 80% of women have hot flashes, and a third say they are frequent, severe, and have a profound impact on their quality of life. They may also disrupt sleep, which can have negative effects. For some, hot flashes can even affect employment, causing women to miss work and be less productive. Although they typically taper off a few years after menopause, some women never stop having hot flashes and night sweats. Fortunately, there are a variety of treatments available. Your experience with menopause may also depend on your race and ethnicity, with a major study of menopause reporting that African American, Hispanic, and overweight women are more likely to experience hot flashes. Another common symptom of the menopausal transition is vaginal dryness, sometimes described as atrophy, in which the walls of the vagina thin and are less moist due to the loss of estrogen. It has a significant negative impact on quality of life, causing painful sex and an increased risk of vaginal and urinary tract infections. Left untreated, vaginal atrophy keeps going and may get worse. Again, there are a variety of treatments available. Other common symptoms that may hit you at this time include anxiety, tiredness, stiff or painful joints, back pain, urinary incontinence, heart palpitations, weight gain, and memory changes. Many of these, of course, could also be due to aging and life experiences, which brings us finally to the issue of treatment. By far the most effective treatment for the most troublesome menopausal symptoms is hormone therapy. This is either estrogen alone for women who no longer have a uterus or estrogen plus a progesterone. Hormone therapy also has other benefits, including maintaining healthy bones, reducing joint pain, and improving quality of sleep. There are numerous types of hormone therapy for hot flashes and other symptoms, including pills, gels, patches, and creams. For symptoms limited to the vagina or for frequent urinary tract infections, treatment with localized vaginal pills, rings, or creams provide relief without risks to the whole body. Medical associations recommend individualizing the dose and delivery method of hormone therapy for each woman. In other words, there is no one-size-fits-all. However, many doctors stopped prescribing hormone therapy after a large study in 2002 found a higher risk of breast cancer and heart disease in women taking hormones. But those results have been further analyzed by age, showing that the risks of hormone therapy were lowest and benefits were highest for women less than age 60 years and within 10 years of menopause, when symptoms are likely the most severe. Today, we also know that the level of risk depends on the individual woman, including her health history. Your decision to use hormone therapy should be based on your quality of life, health priorities, and personal risk factors, such as your age, risk of blood clots, stroke, heart disease, and breast and other cancers. Finding the best option often requires some trial and error, but with patience, you can have a successful outcome. Some healthcare professionals remain unaware of the most recent science and are still reluctant to prescribe hormones, or only prescribe them at low doses for the shortest period possible, which has a significantly negative impact on women's health and well-being. Women, too, remain reluctant to consider hormone therapy due to fears. For women reluctant to use hormone therapy, there are other options. You might try complementary and alternative approaches, such as cognitive behavioral therapy, yoga, meditation, hypnosis, or dietary supplements, which some studies suggest can help with symptoms. Just make sure you tell your doctor about any over-the-counter medications or supplements you take. Non-hormonal prescription drugs may also be used, including an antidepressant that is FDA approved to treat hot flashes. Other medications are used off-label. A new class of non-hormonal drugs not yet available shows promise for treating hot flashes. They target the neurokinin B signaling pathway in the brain, which plays a role in reproduction and control of hot flashes. Several preparations are in clinical trials with impressive results, which means additional non-hormonal options may be available in the future. Whether or not you take medication, you should add lifestyle changes to your treatment. Avoid alcohol, spicy foods, and caffeine, which can make hot flashes worse, and quit smoking. Also, exercise and losing weight can reduce the frequency and severity of hot flashes and prevent heart disease and stroke. When it comes to addressing menopause, you might have to take the lead, something too few women do. One survey found that 42% of women with symptoms severe enough to affect their quality of life never discuss their symptoms with a healthcare provider. Make an appointment with your gynecologist or primary care practitioner, specifically to talk about menopause. Track your symptoms, particularly hot flashes, in terms of frequency and severity, and bring a list of questions with you as well as your symptom tracker. Be completely honest. If sex is painful, tell them. If you keep forgetting things, can't sleep, your hair is falling out, you've gained weight, tell them. All could be related to your shifting hormones regardless of your age. Ask your healthcare provider about medical and non-medical options and discuss the risks and benefits. If you feel as if your symptoms are being dismissed or not taken seriously, it's time to find another provider. You might want to consider a menopause specialist who is certified by the North American Menopause Society. These are listed on their website under Find a Clinician. The bottom line is that every woman will experience menopause in her own way, whether naturally or surgically. It's a passage and something to embrace as you enter the next phase of your life. It's never too late to initiate healthful steps to enhance the years ahead.